Hello dear friends, myself Dr. Kanchan Durukkar. I am a practicing IVF consultant in Pune since 10 years. So today we are going to talk about the very simple but very important topic, and that is how can you conceive naturally. So we will just have a small discussion that how do a female conceives. So generally what happens is you have a 28-day cycle, and the egg starts growing from the second or the third day of your cycle, that is called as a recruitment of your follicle. Then this egg or the follicle grows as you have your normal cycle, and this egg gets mature at mid of your cycles, that is generally on 14th day of your cycle. This follicle or the egg grows up to 20 that is 2 centimeter around, and this follicle ruptures, that is the egg is released, and this egg is very small, it is only 120 micron. So this egg that is released from your ovary, it is captured by the fallopian tubes. Now this fallopian tubes should be healthy, they should be open, that is called as a patent fallopian tubes. Then the egg that is ruptured, that is we call as a ovulation. So these are the two very much important things that the female should have, that is regular ovulation and patent fallopian tubes. So now as the egg has come into your ampullary region of the fallopian tubes, there are various names to this fallopian tubes, and the ampullary region of the fallopian tubes is where the egg meets the sperms. That is, if the natural contact has happened, then the egg will meet the sperm and there will be formation of a zygote. Now what happens next is, after this zygote has formed, it will further form into an embryo. Now this day 5 embryo will go into the uterine cavity and it will get implanted. So the implantation is a very important procedure after formation of embryo, and this takes place around day 5 to day 6 after your ovulation. Then after implantation has happened successfully, your periods will get prolonged and then your UPT will be positive, and yes, you will have the successful pregnancy. So when you are trying naturally, you should think about whether the ovulation is happening or not. So generally, if your periods are regular, that is 28 days cycle, generally the most fertile days are from day 11 to day 16 or 18, and in these days you can have alternate day contact. So regular alternate day contacts are important during this fertile period. Now it is not necessary to have daily contact, but the alternate day contact is enough. Now what happens is the patent fallopian tube, ovulation, and also the normal semen analysis, that is the semen parameters, sperm parameters also should be normal, that is the sperm count, sperm motility, and normal forms, that is a morphology, should also be there for the pregnancy to happen. And if at all the periods are regular or other problems are there, we can do is the blood test, we can do is the sonography, and we can track your ovulation by doing the ovulation study. So this is the further test if at all you are not conceiving naturally, but there should be a 1 year of a natural try period, after which you should consult your fertility specialist if you are not having a conception. So this is a small discussion about how you can conceive naturally in the lap of nature. Thank you dear friends, hope you find this video helpful, and if at all any further information is needed, please visit my page and you can contact me also. Thank you.